Hey Falcons, President Mike Davis here. I am in the brand new Rusty and Kimberly Hutson Family Beacon Simulation Center. It's a state-of-the-art simulation center designed to train our future nurses. This multi-million-dollar facility was paid for through a combination of generous donations and congressionally directed spending. Thank you to then Senator Joe Manchin and current Senator Shelley Moore Capito, who supported this project and helped us get it over the finish line. Here to talk about our new center and the importance of having it here at Fairmont State is Dr. Deb Struth, our Dean of the College of Nursing. Deb, thanks for being here.
Thank you.
So first of all, what does Beacon stand for? What does it mean?
Beacon was a carefully and painstakingly developed acronym by our faculty that stands for Bridging Education to Advance Clinical Outcomes in Nursing. And that's what high-fidelity quality simulation is about, bridging the Education Practice Act to increase the readiness of nurses to enter practice.
Talk about the Hutson family's generosity getting this over the finish line.
Actually, it goes back to 2020 when they made a very generous contribution that allowed us to open our first little simulation area with high-fidelity mannequins. That prompted the purchase of our mannequin Apollo, our birthing mannequin, and eventually the completion of our initial area, which is very rustic compared to where we're at now.
Yeah, if anybody saw my Mike Tries It, I did a Mike Tries It,
Yes.
Working with one of the mannequins. So I got that hands-on learning that we talk a lot about here at Fairmont State. You know, I think every corner of our campus has that hands-on learning, but this is sort of hands-on learning supercharged. So talk about why it's so important for students to be in a setting like this and how it prepares them for the next step.
Every moment a student spends in the simulation center is designed to increase their learning, and they are the focus. So while in our baccalaureate program, there are 720 hours of clinical time, probably some research I've done and what's in the literature is probably 30% of that time is the students waiting on an instructor because the instructor has 8 students and at least 8 patients that they're responsible for. Yeah. The student is the focus. Every student is a focus.
Awesome. One of your faculty said to me last year that her goal as an instructor is if you're about to go under for surgery and you say to someone, "Where'd you go to college?" and they say, "Fairmont State University," that as you're going under, you feel like you're in good hands. Talk about the impact that a center like this has on really sort of stress testing the student's ability to do all of the different tasks that is required of a nurse.
Absolutely. It actually makes them accountable. There's no hiding in the lab. And there's also peer-to-peer feedback that we haven't had the capacity for. Mm-hmm. So even looking at our 3 pre-briefing, debriefing rooms that at first blush just look like conference rooms, right? Those 7 other students who are sitting in there have at least 4 different angles based on the cameras in each room to observe their peer and learn and say, why'd they do that? Why'd they do this? And immediately say, when the debriefing begins after this scenario, we begin the process of questioning. Yeah.
I've said it's almost like game tape if you're an athlete, right? The number of how many cameras are in here? Do you know?
4.
4 in just this room, but how many in the whole?
Every single room right now pulled up on my laptop are all 12 rooms live.
That's awesome,
yes.
Right? So it allows instructors, it allows peers to go back and see what you might not have seen if you only had. Would we have 1 camera before?
1 camera that very often wasn't functional.
Right. So, and then there's even just observation rooms, like off to the side here, there's an observation room so people can see it live and then go back and look at it. I think that's amazing. So we've had some semblance of a sim lab here since 2008. But talk about all of the different spaces. There's not just a room like this, but there's lots of different spaces that allow nurses in all different settings to simulate what they'll do out in the field.
Absolutely. We actually have 4 major instructional areas that allow the 4 major spheres of care to be replicated. Obviously, we have acute care. We're sitting in our trauma room. We also have 2 labor and delivery and recovery rooms here. So we have mom mannequin and a neonate. We have a pediatric room, and then we have 2 adult inpatient rooms. So we cover acute care. We also have clinic care. So we have 4 treatment rooms and a triage area. We have a pediatric room. And these rooms can largely accommodate standardized patients in addition to mannequins. Our goal is standardized patients. Long-term care and community-based care through our living learning lab, which is a 1-bedroom apartment that we would replicate home care visits or even a long-term care environment. And then the pre-briefing, debriefing rooms, which really allow the learners to observe each other. But the system also allows the nurse to view their own performance, right? Because what that nurse in the room taking care of our simulated patient has to deal with is their adrenaline level, their nerves, and a mind that just won't always calm down, right? Yeah. They're under pressure. And they miss things, or they do things they're not even aware about. And sometimes their peers or the instructor will call them out on it. Now they have 24 hours and a private place to sit down and look at their own performance and awesome. Learn from it. Yeah.
Yeah, it's really interesting as you walk in, it looks like a hospital, right? There's nurse stations and things like that. That my guess is most other universities that are doing work like this don't have that, right? And when I look around, my biggest concern is this is almost too nice. So when they go out to work in a location, it's not going to feel as nice, right? I mean, that's how nice this facility is compared to, others around the country.
We actually raffled off a free peek at the center probably close to 2 months, well, before the end of the academic year, 2 months ago or so. And we had 17 students we brought through. And one of them works at a local trauma center. And he walked through here and he said, "This is just like work. This is better. The cabinets are new."
Right.
And so
yeah. Fully stocked and all that kind
exactly,
of stuff. Yeah, absolutely.
Exactly.
So talk about nursing as a career in West Virginia. We know there's a tremendous need. That need's not going anywhere. Talk about the need in the community and what Fairmont State's doing to try and help fill that.
We have tremendous needs in the state. We have areas that are terribly underserved. So when you look at the data, West Virginia boasts probably 12 to 16 RNs per 1,000 people. But there are areas of this state, as we all know, that don't have access to adequate health care. So one of our goals is to really train people in population health and community-based health. And we're incorporating and using these areas within our simulation lab. But even with the more population-dense areas of the state, we probably have a projected need of 1,000 nurses more to the state every year through 2030 based on current data.
Yeah, I talk a lot about, one of the nice parts about our nursing program in a center like this is we have students from all 55 counties, and all 55 counties need nurses. So we can bring people here, we can train them, and then they'll go back to their community and have the best possible educational experience they had so then they can serve those communities. So why should a student who's deciding between various nursing programs choose Fairmont State?
First and foremost, I think that I have to say this, it's our faculty. These are Falcon nurses. Almost all of our associate degree faculty have at least one degree from Fairmont State, and most have their baccalaureate degree from Fairmont also. So there is a culture and an understanding, and they're West Virginians by birth. And they chose to stay, and they model that behavior for the students. And our students are excited to explore the opportunities and stay, as you said, in their communities.
I love that. One of the things I say every year when I talk at the nursing pinning ceremony is I'm amazed at the the sacrifice that nurses make, and the fact that they're willing to be in these high pressure situations you're talking about. So I really appreciate what you and your faculty are doing and everything you've done to get this center off the ground. So we really appreciate it. So the ribbon cutting is August 27th at 1 o'clock. Join us in the Atrium of Education building, and then we'll do tours here. There'll also be an open house later for faculty, staff, and students. But this is a tremendous example of Fairmont State finding ways to make sure that our students from across the state and across the region are ready from day one to do the job. So we're really excited to see what this center does and the impact it's going to have on the entire state of West Virginia. Thanks.